Hi, my name is Todd Brown, and I want to welcome you to this special presentation of Accident and Injury Recovery Secrets. I'll be your host for the next 20 minutes. What you're about to discover on this DVD is how to quickly recover from your accident or injury and return to feeling just as good, if not better, than you did before you were hurt. Please keep in mind, accident and injury recovery is commonly mishandled by a lot of physicians and is something millions of Americans suffer through every year. An ineffective and unsuccessful recovery plan can quickly lead to decreased levels of activity, chronic discomfort, and overall deterioration of one's health and quality of life, and even financial hardships. Thankfully, with this DVD, you'll never have to experience any of that. Instead, in the next 20 minutes, you're going to discover a number of the secrets to quickly and permanently recovering from your injury naturally, including why following your family doctor's advice on how to recover is one of the most dangerous things you can do. How taking pain medications may provide short-term relief but will cost you your long-term health. The shocking and scary statistics about the dangers of surgery. What you can do right now to free yourself of your nagging injury pains and hop onto the road to recovery. And best of all, at the end of this DVD, you'll discover the ultimate solution that will not only provide the fastest and most effective way to recover from your injury in a completely natural way without the risk of any nasty side effects, but will let you experience that relief with zero expense. Sound pretty amazing? Well, it is. And you're about to find out why. Let me ask you, do you ever find yourself asking any of these questions? How long is it going to take to recover from my injury? What will my life be like if I don't recover soon? What if my injury never gets better and only gets worse? It's completely natural and normal to find yourself asking these types of questions when you've been in an accident or suffered an injury. And it's also quite normal for the fear of the answers to leave you feeling somewhat frustrated or even depressed. But it's so important to understand that you are not alone in your struggle. Every year alone, there are over 6 million car accidents. Combine that with the number of accidents and injuries in the home, at the gym or playing sports, and on the job, and it's virtually impossible not to suffer an accident or injury at some point. Accidents and injuries are just a part of normal life. They happen to even the healthiest of people. But here's the real danger. Did you suffer an injury but haven't done anything about it since the pain isn't, quote, that bad? Many times you won't feel pain immediately after an accident, even though your body is, in fact, injured. Left untreated, the damage your body has suffered and your discomfort can worsen with time. Did an emergency room doctor perhaps tell you you were, quote, okay? Emergency rooms are absolutely the place you need to go if you're bleeding or have broken bone. However, unless there is an immediate threat to your life, the hospital will send you on your way with some painkillers. They are not meant to help you recover. Did your medical doctor take an x-ray and say, quote, everything looks fine? Hidden injuries cannot always be seen on an x-ray, and most medical doctors are not trained to detect soft tissue injuries. But your body doesn't lie. You know when you're in pain or your body isn't working the way it normally does. Many people shrug off the seriousness of their injuries and delay their recovery. Delayed recovery means a longer period of nagging pain and discomfort you have to put up with. Regular pain and discomfort, no matter how small, will slowly wear you down day after day. Has your accident or injury made it harder to do your job? A longer recovery means lower work performance or maybe even missed time on the job, especially if the area you injured is necessary to perform your job properly. Have you been less active and getting less exercise than before your injury? Probably. Most people do. That's why it's so common for people who are stuck in the recovery process to gain weight and fall out of fitness shape. Has your injury affected your ability to get a good night's rest? Well, many people do not sleep as well as they did before they suffered an accident or injury. In fact, there's a good chance you can make your injury worse and wake up in pain or discomfort if you move in your sleep or lay the wrong way. Has your inability to get better affected your relationships and personal life at all? Regular pain creates anxiety, stress, and even anger. The inability to do the things you normally enjoy with friends and family, like taking a walk, going to a movie, being intimate with your spouse, or even just enjoying dinner at a restaurant, all may become a hardship. And doing anything special, like taking a road trip or relaxing vacation, is probably the furthest thing from your mind. It becomes difficult to focus on other people's needs when you're in so much pain and discomfort. Simply put, when you cannot do the things you normally do, perform the work you usually perform, uphold the responsibilities you usually uphold, it's very easy to start feeling bad about who you are. To make matters worse, insurance companies want to save money by making your treatment as quick and short as possible. This means your body is never actually healed, and you don't ever actually recover the way you need to. An injury that you should recover from in a few weeks can last months or even years. Missed work, a stressful personal life, poor self-image, and a lack of sleep. It's no wonder that accident and injury victims become easy targets of depression. The combination of all these difficulties can easily make anyone feel as if their life is falling apart. Most depressing of all is the fear of, what if my injury never gets better? What if my pain only gets worse? Whether you've only just experienced an accident or you've been suffering from an injury for years, chances are you would not be watching this DVD if your condition was not impacting your life to some degree. At this point, you may have already tried getting some relief from some over-the-counter painkillers or anti-inflammatories, or maybe you've tried regular hot baths or even massage. The bottom line is, you're probably still in pain and you want a solution. Maybe you're considering going to a doctor, or maybe you've already seen one. Well, here's a word of warning. Before you step foot into your doctor's office again, or for the first time, it's critical you hear the truth about the allopathic medical road to recovery. You may be shocked and possibly even outraged by what you're about to hear. Please remember, these are not the opinions of the creators of this DVD, but the publicly documented findings of independent scientific studies and medical organizations. Simply stated, conventional medical doctors are trained to treat your aches, pains, and sicknesses in generally one of two ways: through the prescription of various medications, or in some serious cases, through surgery. That's no big secret. However, did you know that medical doctors are trained to treat pain, not help healing and recovery? In fact, let's take a close look at what conventional medicine has to offer you if you choose to visit your medical doctor in hopes of finding effective injury or accident recovery. Did you know that each year in the United States, an estimated 140,000 people die from drug-related reactions they get after taking a prescription medication prescribed by their doctor? It's estimated that up to 98,000 Americans die yearly from medical errors. For instance, a doctor accidentally making the wrong incision, a nurse administering the wrong medication, and so on. That's almost 250,000 deaths each year in the United States alone due to the adverse effects of surgery and drug treatment. It's certainly good reason to start questioning what we learned as kids about running straight to the doctor, right? Well, if you go to the doctor complaining about your injury, unfortunately he or she will have nothing else to do other than reach for their prescription pad and offer you drugs. And you can place your bet your doctor is going to recommend or prescribe one of the following types of medications. 1. Over-the-counter painkillers like Tylenol, Advil, or Motrin. 2. Prescription painkillers like Percocet, Vicodin, or Oxycodone. Or 3, prescription muscle relaxers. Let's first talk about the scary truth about over-the-counter painkillers. While these medications can be fairly safe over the short term, it's only when they're taken in amounts not exceeding the recommended dosage and for a short period of time. The problem is, due to the chronic and severe nature of most injuries, it's almost impossible for a doctor to provide you relief while sticking to these usage guidelines. And because most injury-related pain is chronic, it will not go away after a couple of days or a week. In fact, it will never go away until the underlying cause of your pain is remedied. In other words, taking over-the-counter painkillers is a temporary band-aid that will not help you recover or heal any faster. Now, you might be wondering, what's the big deal about taking a little extra Tylenol for a few weeks or even months? I can buy it at the supermarket. It can't be that dangerous. Well, a breaking new medical study done confirms the health risks and dangers of over-the-counter painkillers. Ulcers and intestinal damage were only some of the common side effects seen in people using over-the-counter painkillers for too long or in too high of dosages. So, if your doctor tells you to just rest up and take some Tylenol for the pain, and he advises you to do this for any length of time more than about a week, or if the recommended dosage exceeds the restrictions on the bottle, don't do it. You will undoubtedly damage and possibly severely injure your stomach. Again, even the manufacturers admit on the bottle's label these medications are not meant to be taken in large dosages or for extended periods of time. Regrettably, the majority of the medical community chooses to ignore the risks, and they don't admit the dangers these various medications pose to your health until the damage is already done. There is some good news, though. The FDA is finally beginning to do some studies to find out the risks over-the-counter painkillers pose to people suffering from a nagging pain and injury, like yourself. The FDA found when taken for long periods of time, Aleve and Naproxen, two of the most popular over-the-counter painkillers, may actually increase the risk of cardiovascular disease. And we haven't even talked about the potential liver damage that results when taking these drugs for a period of time beyond that indicated on the label. Point being, if you have seen or see a doctor who recommends you take over-the-counter painkillers in any amount or length of time exceeding the FDA advertisement, turn and run. Do you really want to suffer decreased cardiovascular health, ulcers, and a toxic liver in addition to the pain from your injury? I think not. Now, what if instead of recommending over-the-counter painkillers, your doctor chooses to prescribe a narcotic painkiller for your pain and discomfort? These drugs are different from aspirin and Tylenol and whatnot because they are derived from opiates. What does this mean? You guessed it. In addition to the many other health risks, these drugs are highly addictive. You might recognize these substances by their more common names. Perhaps your doctor has already prescribed one of these after you had your accident or suffered your injury. Percocet, Vicodin, codeine, oxycodone. Do these drugs work? Absolutely. If your definition of working is to provide relief from severe or chronic pain. However, each and every time you take one of these drugs to relieve your pain, your body develops a greater tolerance. For this class of drug to continue working, you are required to take higher and higher doses. Keep in mind, this class of drug is a derivative of opiate, the same substance used to make heroin. I know it sounds crazy, but it's the truth. Taking these drugs for pain is a surefire way to dependence and addiction. Not to mention, the agony of withdrawal symptoms when you attempt to stop these drugs can be pretty brutal on your body. Whether your doctor prescribes a narcotic or non-narcotic painkiller for your pain and injury, the critical problem is this. None of these medications actually fix or heal your injury. Therefore, as your pain and discomfort persists, if you do not seek other help, you must take these drugs and in higher dosages to function. In your quest to recover from your accident or injury, you must be careful not to compromise and endanger your short and long-term health. This is critical. Now, some doctors stay away from painkillers with their accident and injury patients and instead prescribe muscle relaxants. The problem here is that muscle relaxants don't get to the root of your pain and only force your muscles to loosen up. Meanwhile, the tight muscles are the body's way of protecting further damage to your injured area. By taking muscle relaxants, you're forcing the body to stop protecting itself. This is why when most people stop taking muscle relaxants, their injury is even worse and they're in even greater pain than before. This is not something to take lightly. If you choose to seek help from your medical doctor for your pain, there's one last treatment he may prescribe. It's not a drug in the sense that it's a pill, but it is a medication. And it's especially popular for low back pain and leg pain known as sciatica. It's one of the most frightening medical treatments of all. Welcome to the world of epidural steroid injections. This is a common choice for treatment of back pain by a lot of medical doctors. Here's how it works in a nutshell. In an attempt to reduce back or leg pain and inflammation, pain doctors use an X-ray guided injection of steroids directly into your spine. Does that sound fun? Does it sound dangerous? Well, the PDR, the guidebook doctors are supposed to follow when prescribing medications, specifically states, quote, suitable sites for intra-articular injection are the knee, ankle, wrist, elbow, shoulder, phalangeal, and hip joints. Joints not suitable for injection are those that are anatomically inaccessible, such as the spinal joints. Again, joints not suitable for injection include spinal joints. If you're bold enough to ask your doctor whether or not the PDR approves of the large needle he wants to stick in your spine to help your back or leg pain, don't expect a straight answer. If your doctor admits anything at all, he'll probably say the PDR is just being overly cautious and he's injected hundreds of spines without any complaints. Ask him why it is then that epidural steroid injections have been banned in several countries around the world. You don't have to be a brain surgeon to realize injecting a syringe directly into your spine is not a safe or natural way to relieve back pain. An epidural injection delivers steroids directly into the very thin epidural space in the spine via a very long needle. And according to studies, blind needle injections, even by skilled and experienced professionals, has been found to be inaccurate 25 to 30% of cases. That means if a pain doctor wants to give you just a single epidural injection to help with your injury or pain just to see if it works, you have a 1 in 4 chance of becoming victim of an inaccurate injection. And that's if he's a skilled and experienced professional. So, what's the big deal about haphazard inaccurate injections to your spine? Well, just ask Dennis Capolongo. A nagging hip pain prompted Dennis to visit his doctor. After receiving just 2 epidural injections, he suffered 2 trips to the hospital, was hospitalized, and suffered non-stop back pain. That's not even the real tragedy. Dennis developed arachnoiditis, a pain disorder caused by the inflammation of the arachnoid. That's one of the membranes that can be easily damaged as a result of blind epidural injections. He can no longer work or do anything he used to because of his condition. He describes the condition as, quote, sheer, hopeless hell. And there is no cure. Dennis invests the little strength he has to warn unknowing patients like yourself of the horrific dangers of epidural injections. Does this form of treatment sound like something you should gamble on? I would think not. Now, let's just recap everything you've learned so far about the only drugs your doctor can prescribe to help you recover from your accident or injury. Over-the-counter painkillers, which have been proven to erode the stomach, cause ulcers, and turn your liver toxic. Prescription painkillers, which will also inevitably lead to dependence and addiction. Muscle relaxants, which will mask your pain while you do even greater damage to your body. And finally, the epidural spinal injections, which can leave you terminally sick, paralyzed, or worse. I hope you see that none of these are a wise choice to eliminate your pain and recover from your injury. Now, with drugs out of the question, there is one more form of treatment your doctor may recommend for you to relieve your pain and recover from your injury. Surgery. Now, before you jump at the chance to go under the knife, remember that there are almost 250,000 deaths each year in the United States alone due to the adverse effects of surgery and drug treatment. Certainly surgery is the right choice for certain conditions, like repairing a broken bone, for instance, but that still means you have to recover afterwards. What is most alarming are the shocking statistics that not only are many surgeries ineffective and actually cause more damage, but many are unnecessary. According to PhD and renowned author Gary Null, it's estimated that 7.5 million unnecessary medical and surgical procedures are performed each year. Instead of fixing or healing your injury, these unnecessary procedures can lead to greater health problems and even death. In 1995, a report by Millman and Robertson Incorporated concluded that nearly 60% of all surgeries are medically unnecessary. So, in the hope of getting rid of your nagging injuries so you can be pain-free and your body can get back to normal, surgery can easily mean paying a ton of money for an unnecessary procedure that results in permanent damage to your body. Anyone who has ever undergone surgery will tell you, once you go under the knife, you will never feel the same. The body will never be the way it was again. Nobody is questioning how troublesome and debilitating your accident was or your injury is, and nobody is saying you should have to live with it. However, medications and surgery will not provide you the pain relief and recovery that you want and need to return to your normal life. It's not all that complicated. Medical doctors are not trained to heal and help recovery. That's why they just prescribe medications or refer you to other specialists who will either prescribe harsher medications or recommend surgery. The most you can hope for when going to a medical doctor is a little bit of short-term relief. Now, at this point you're thinking you might be best to just rest up and hope your pain and discomfort go away. Maybe that's what you've been trying to do so far. In fact, if your medical doctor is a bit more conservative, he might have even advised you to rest up until your injury feels better. Certainly the first step in treating any injury or ailment is to rest. Bed rest is a good medication, so long as it only lasts 2 to 3 days. You see, prolonged bed rest can actually make your injury even worse. Dr. Scott Fishman runs the pain management program at the University of California, Davis School of Medicine. He reveals that while years ago doctors recommended bed rest to give patients time to heal, that it's absolutely not recommended today. Moving is essential in order for the joints to flush out toxins, feed themselves, and begin the healing and regeneration process. So, if you've been thinking about just laying in bed until your pain and discomfort go away, think again. There's a much better chance prolonged rest will make your back even worse. So, here's the million-dollar question. If medication, surgery, and bed rest cannot help you, what can? What in the world is going to relieve your discomfort and help you quickly recover? Well, there's a very exciting answer to that question. First, let me just ask you this. What if there was a solution that would allow you to recover from your pain and discomfort without any risks and would restore your body to normal health? And what if this recovery remedy was completely natural and you could begin to experience the relief completely for free? Well, hold on tight as we take a quick trip back in time to uncover a little known and even lesser understood secret about the true path to injury and accident recovery. Dating back thousands of years, early age doctors in ancient Greece, Rome, India, and the Orient studied and practiced relieving pain and restoring health by resetting the alignment of the spine to its natural state. Over the centuries, with the advancement of technology and modern medicine, this method of healing the body has continued to evolve and advance. Yet, it remains grounded on the same ancient wisdom that if you heal the spine, you can heal the body. Unlike modern medicine with its constant discontinuation of surgical procedures, once thought to be safe, and recall medications now known to actually harm you, this healing and recovery practice has absolutely withstood the test of time. It remains the only way to relieve your pain and allow you to recover naturally without any medications, surgery, or risk of nasty side effects. The relief and recovery you seek can only be found in the little known and commonly misunderstood world of chiropractic care. If you've heard about chiropractic before, it's a good bet what you've heard is false or inaccurate. Most of the talk about chiropractic care is based on hearsay or senseless jokes about how they crack and snap your spine. Well, this couldn't be further from the truth. You see, the word chiropractic is of Greek origin and simply means treatment by hand. While modern medicine is fraught with nightmarish tales of surgeries gone wrong and untested drugs which get recalled only after the damage is done, chiropractic care is a successful drug-free, hands-on treatment for pain and recovery that has persisted for over 5,000 years. Chiropractic healthcare is a form of medical care which emphasizes the natural recuperative power of your body to heal itself without drugs or surgery. It does so by focusing on the relationship between the spine and the nervous system. Since your nervous system controls all of your body's organs and tissues, a well-functioning, clear-communicating nervous system allows your body to properly recover from injuries causing pain, like whatever pain you're suffering from caused by your accident or your injury. In other words, chiropractic care will allow your body to naturally recover from the root cause of your pain and will allow you to finally feel good. Now, you may have avoided going to a chiropractor in the past because of something you heard from someone you know. These are what we call the chiropractic myths. Let's quickly cover them. Myth number 1, chiropractors are not real doctors. Not only are they real doctors, but it actually takes 7 years of school in a curriculum similar to a medical doctor's training to complete their schooling. And in order to earn their license to practice, chiropractors must then successfully pass a state and national board examination in the very same way MDs are required to. Myth number 2, chiropractic treatments hurt. This couldn't be further from the truth. Most chiropractic patients find chiropractic adjustments very relieving. The mild pop some patients report hearing while being adjusted is just the natural release of gas bubbles that have become trapped in the joint. It's the same as when someone cracks their knuckles. The loudness of the sound varies from patient to patient and has very little to no meaning. Myth number 3, once you go to a chiropractor, you have to keep going forever. Although many choose to continue their chiropractic visits simply because of the incredible health and vitality chiropractic care brings them, some patients actually experience lifelong benefits with just a few weeks of treatment. Myth number 4, chiropractic care is not safe. Now, this is the biggest myth of them all and one that is misleading thousands and thousands of people. Since chiropractic medicine seeks to restore your body to its natural state of health, unlike allopathic medicine, chiropractic is recognized as one of the safest types of healthcare in the world. It does not include any of the nasty side effects or risks associated with drug therapy or surgery. In comparison to allopathic medicine, which uses drugs and surgery as the core form of treatment for back pain or injury recovery, chiropractic presents far less risk. This is why chiropractors enjoy the lowest malpractice rates in the entire field of medicine. Even the insurance companies have been forced to admit there is no safer care to help you recover from your accident or injury than chiropractic care. Now, you may already know someone who's experienced the life-changing relief of chiropractic care. You may also know someone who's gone for a single chiropractic treatment and claimed it didn't work. Well, here's the sad truth. In today's fast food society, most people opt for the convenience of popping a pill rather than getting the treatment they need to permanently recover from their accident or injury. Many give chiropractic a try, but are simply too stubborn and depressed to believe they can ever recover from their accident or injury without drugs or surgery. Still others are so reluctant to try something new that doesn't stick to what the medical doctors have told them that they delay getting help so long that by the time they arrive at the chiropractor, their condition is virtually untreatable. Regrettably, it's not uncommon for other accident or injury sufferers to find themselves thinking or saying these exact things about chiropractic care because they simply don't understand it. You might have had very similar opinions before watching this DVD yourself. But now you've taken the time to get educated and informed about accident and injury recovery secrets, and that is quite admirable. You now know the truth about the commonly accepted but highly ineffective and dangerous pain treatments medical doctors will offer you versus the completely natural, safe, and highly effective care you're going to receive from a chiropractor. At this point, you're probably eager to discover exactly how chiropractic care can help you and your nagging injury. Or maybe you're hopeful but still a little hesitant. Well, the great news is there's no need for you to worry or take any risks. Discovering how chiropractic care can help you is fast, easy, and best of all, free. We'll get to the free part in a moment. First things first, you might be wondering, do you need a referral from an MD to get a chiropractic treatment? No, you do not need a referral from your family doctor or primary care physician before visiting a chiropractor. In fact, what most people don't know is that federal and state regulations view chiropractors as a first contact physician. In other words, they are primary care physicians. You might also be thinking, but isn't chiropractic care expensive over the long haul? Well, the answer is no. The majority of all insured American workers have coverage for chiropractic care, and that percentage is increasing regularly. In addition, most doctors offer affordable payment plans to accommodate those who are not covered. If you happen to have to pay out of pocket, you can rest assured you will still be saving money over the alternative. But we want to make it as easy as possible for you to experience the secret of accident and injury recovery with chiropractic care. Inside the package that came with this DVD, you'll find a written letter inviting you to receive a chiropractic accident and injury recovery consultation absolutely free of charge with no strings attached. We don't think your pain is in your head or that you're exaggerating, and we definitely don't think a nagging or painful injury is something you need to learn to live with. No way. That's why we want to give you the opportunity to quickly and easily discover how you can hop onto the real road to recovery with chiropractic care. However, there is one essential requirement you must meet. You must have an open mind. We're more than happy to answer all the questions you want to ask when you visit. I mean, that's what educated people like yourself do, and that's why we created this DVD for you. However, at the end of the day, you must be prepared to give chiropractic care a real chance, to listen to the guidance and wisdom of your chiropractic doctor. Without an open mind and willingness to comply, chiropractic care cannot help you. And most importantly, do not delay. The majority of patients who visit a chiropractic doctor for the first time that have been in an accident have usually been in a car crash. Regrettably, many of them do not come for help until they've tried everything else and their injury has spun off, creating all sorts of different problems in their body. It is not unusual for a person to ignore the slight neck pain they have after getting rear-ended, only to develop severe pain in their arms or legs years later because of the untreated injury. Doesn't it make sense to take a few minutes today to visit a chiropractor so you can rest at ease knowing that you're on the right road to recovery, rather than learning the hard way years later that your body never actually was healed? You're now faced with a choice. You can choose to continue suffering with the pain and discomfort of your injury, to continue suffering the negative impact of your accident on your relationships, the added financial stress, and possibly even lost time on the job, to listen to well-meaning but misguided medical doctors who want to provide you momentary relief from your pain with dangerous medications, jeopardizing your long-term health, to follow your surgeon into the OR for a surgery and permanently risk your health and your life as you go under the knife, and to listen to your supportive friends and family who mean well, who have unfortunately also been lied to about painkillers and surgery being a cure-all solution. Or you can contact our office right now. Tell us you want to take advantage of your free accident and injury recovery consultation. During your visit, you'll discover exactly how you can begin experiencing the relief from your pain and discomfort, and how you can hop onto the road to recovery and return to your normal life. There's absolutely no risk or obligation to you. Now, you might be wondering, why would we take time out of our busy schedules to see someone like yourself and not charge you a dime? Well, simply stated, we absolutely believe in the relief and injury recovery we can provide you, and we're confident after meeting us and experiencing it for yourself, you will too. Take a look at the letter that came with your DVD and give us a call right now. Just say you're calling for your free accident and injury recovery consultation, and we'll take care of the rest for you. The only thing you have to do is prepare yourself to experience the true secrets of accident and injury recovery, and start making plans for what you'll do when you're finally better than new. Don't wait until your pain or injury gets even worse. Call now. The secret to your accident or injury recovery is waiting for you.